Depression is an illness that covers a range of symptoms. At one extreme, you've got simply being a bit sad, and at the far extreme, you've got feeling life's not worth living and you're ready to end it all. The symptoms along the way vary in severity, and there's often mixtures of anxiety and depression together. The cardinal symptoms of depression include sleep disturbance, appetite disturbance, low mood, losing interest in things that you would normally enjoy doing, that kind of thing.
Is it the case that you would maybe feel happy one day and sad the next, and that still could be classed as depression? Or does it have to be a constant feeling of being low to make it kind of proper depression?
This is an interesting discussion that doctors often have at the sort of mild end of the illness. And everybody's allowed to have a bad day, and that doesn't mean you're depressed. And everybody who's depressed can have the odd good day. It doesn't mean they're not depressed. There's a balance to be struck somewhere in the middle, and the answer is that most days are bad days.
You mentioned worry when you were talking before. Everybody worries, and we all have big events that happen in our lives that we cope with in a greater or lesser extent. Worry's good, isn't it? I mean, we need to worry, don't we?
We do need to worry. Everybody should get a little bit anxious with certain events. You know, a job interview. Some sportsmen worry before they go on the pitch. Actors worry before they go on the stage. If you don't worry, it possibly means you don't care, in which case you'll underperform. So a little bit of worry, a little bit of anxiety is good. It's when it becomes all-encompassing and it takes over your life. That's when it's not good.
If you are feeling those things, can you recognise it yourself, or does it take somebody else to say, look, hang on, I think things aren't going well for you at the moment?
People having their first attack of depression tend to come in because somebody else has noticed that they're not performing as well as they would normally. They're a bit unhappy, they're a bit tetchy, easily angered. And that often the first time people come in, it's because somebody else has noticed that their mood has changed. But when people are having recurrent attacks, they often recognise the symptoms themselves because they've been there before.
And is it the case that if you have one attack, you're likely to get more attacks?
If you've had one attack, you're more likely to have another attack, but it doesn't mean you'll necessarily have another attack. And that depends on how your brain's wired. You can consider that some depression is simply that people have a brain that's wired in a way that it will become depressed, and there are some people for whom depression is a lifelong problem, and there are other people who, given the appropriate amount of stress, will become depressed. And my view is that everybody could be depressed if the right set of circumstances arrived at the right time in their life together.
For that particular person.
Exactly.
And so how does sort of alcohol and recreational drugs and things like that play a role in depression?
Alcohol has a two-pronged aspect. Firstly, people who are anxious, particularly depressed to a lesser extent, sometimes use alcohol as a way of masking the symptoms, and sometimes people become alcoholics because they don't realise that they're actually just using alcohol instead of going to the doctors and getting an antidepressant, and it's simply masking the underlying problem. On the other hand, alcohol itself is a depressant, and if you drink, it will depress your mood. So alcohol can cause depression, and people can take alcohol in order to mask the symptoms of depression. The same is true of some recreational drugs, and we're learning more and more about recreational drugs, and particularly at times when the brain is actively developing, and the brain is actively developing right up to early adulthood, and we realise now that particularly cannabis is causing quite significant effects, more severe than depression. We're actually seeing some quite severe psychotic symptoms that are being attributed to the use of cannabis. And cannabis in itself is a drug that people use to mask anxiety, and so it's the same as alcohol. It can both cause and relieve the problem.
You mentioned, popping to the doctor and getting an antidepressant. But Is that what's going to happen if you work out that actually you need to seek medical advice? You go to the doctor. Are you automatically given drugs to deal with it, or is there a different treatment?
Nowadays, we try and encourage people to go for talking therapies, what's called cognitive behavioural therapy, which is counselling, if you like, where people will talk you through your problems and try and help you to understand why you feel the way you do, and give you strategies that you can use in your own head for dealing with the symptoms. And that would be the preferred option at the lower end of the disease. At the more severe end of the disease, then there probably is a need for drugs to be used, but they are not the first choice. And the majority of people who go to their doctors have mild to moderate depression, which can be helped by talking treatments.
And does that take some convincing that person would benefit from talking therapies? We all don't really like to open up to a complete stranger and start, telling them about our mothers and things like that. I mean, counselling has a bit of a sort of reputation sometimes. It's not so easy to pick up on if that's not what you want to do.
That's very true. It's horses for courses. Some people like the opportunity to unburden themselves to a total stranger in the knowledge that he or she doesn't know them, and nothing's going to come back. Other people find it quite difficult and would prefer to talk to somebody that they feel comfortable with. And in that respect, we often use our nearest and dearest as counsellors without realising it, and we share our worries with them. And people who have a good confiding relationship, somebody who they can share their secrets with, often a partner, but maybe a friend or a parent, often don't need counselling because they effectively do it for themselves. But it is true that some people respond very well to counselling and some people hate it.
It's important to look and see that you have that support network in your life, that there is somebody that you can go to, be it the complete stranger or be it the person next door, who can give you that sort of support.
And that's very true. People who have a good network are less likely to become depressed in the first place. People who are more prone to depression tend to be people who are isolated in the community for one reason or another.